Calm Down Girl here with my take on the Clancy case. Um, I have a different take from some people, some mental health professionals, and I'd like to just take a moment to play out some of the reasons why I think that there's a lot more psychopathic tendencies in Miss Clancy than some of the other theories as to why this happened, and simply blaming it on postpartum psychosis. So some of the reason why I think that has already been a history of psychopathic, sociopathic, narcissistic tendencies would be a lot of these behaviors, these extreme black and white behaviors, were happening pre-meds, pre-doctors, and pre-murders. Some of the examples of this are the extreme black and white mindsets. For example, extreme workout regimens before children and also after children. It's pretty unheard of for someone to do a 5K right after they've given birth, or start to do extreme workouts, things like that. This gives us a lot of evidence to go by that she's a very extreme thinker. She thinks in very black and white terms, which does not bode well as a parent. Children are imperfect by nature. That's how they are. They're growing and learning, and they're not meant to be perfect. They're not meant to perform for their parents to make sure that they're not stressed out. So this poses a huge problem for someone who has sociopathic, psychopathic tendencies, because it's going to cause them a lot of extreme stress, because people with personality disorders view their children as extensions of themselves. They don't see the disconnection. Even if you're a young child, of course, when you're a baby, you're completely dependent on your mother. But even as people with these personality disorders, even as their children age, they still expect these children to continue to be the perfect representation and extension of themselves. And I believe that even by some of the things that came out in court this week, it confirms that even more, that in her mind, what they're calling the part of the psychosis for her was that if she had to leave this earth, then they had to go with her, which is not always the case. It's highly not the case. Also, extreme expectations of herself and others. For example, the very extreme expectation that a medication would work or not work, or that she would be able to determine if a medication was working or not working within 2 to 3 pills. Especially as a nurse, I don't understand. I know that she was a labor nurse. I know that she wasn't, in pharmacology or anything like that, but I also know that there is basic training in these things, and anyone is going to know that it's going to take a while to find out whether a medication is going to work or not work. Anyone would know that if you don't stick with the same provider and you half tell them about what's going on, and let's face it, as a mental health provider, people are not going to be completely honest with you. That's a given. They tell you what they want to tell you, and sometimes if you continue with the same person, they might end up telling you more later, but that's normal. However, her history, even in this, in leading up to this, is, having extreme expectations of providers. Legally, I don't understand how these med chats are legal in the state that she's in. It's extremely dangerous for her, but it's also extremely dangerous, as we're seeing, because they're all being sued. Well, most of them, except for the friend of the mother or the mother-in-law. Providers should not be available 24/7. Lindsay was using these people as her online therapist. These people were nurse practitioners and or doctors. They were not therapists. She was continually encouraged to go to therapy, and when the therapist got on the stand, she reported in her testimony that Lindsay mostly wanted to talk about meds. So people out there that are saying, she got every type of help. No, her anxiety, she had extreme anxiety. There's no doubting that. There's no debating that. Her anxiety was greatly about the medication, and she was extremely demanding. She expected people to respond to her multiple times a day on this med chat, which should be illegal. It's not safe professionally to be advising people about med changes, but I could tell even by the testimony of the doctors that she would be calling multiple times a day, demanding a call back, not on her regular appointment time, but just whenever she wanted to talk. One of the examples was that she was wanting a med chat response about her Apple Watch reading. Like, this is a person that is extremely demanding and expects people to drop everything and meet their needs. It's also very apparent, and this is a very in tune with a narcissistic type, borderline type personality disorder. The world revolves around them. There's no thinking about maybe that this person has 5 other patients that they have to see and that they don't have an appointment, and that possibly maybe this doctor doesn't have 5 times in one day to respond back to you about some sort of fear that you have. So that's a huge red flag for me. My question too is, this is a really sad detail that came out this week. I think that because she saw her kids as an extension of herself, everything outside of herself was to blame. There was no internal reflection about, like, what am I doing to contribute to this problem? And it's not like mental health is a problem that she caused, but it's like, yes, you're reaching out for help, but am I sticking with one provider? Am I being honest with the provider of what I'm taking, what I'm not? And also, am I self-reflecting and not some of these outward things, like the outward factors were at fault. Her constant comments about how she never felt like this before the meds, that I beg to differ. She was already like this. So it wasn't the meds' faults that she was struggling. She was already struggling before she even put any pill in her mouth or didn't take any pill in her mouth. The kids were not the problem, but I believe in her brain and her warped thinking that the kids were blamed for her stresses and her mental health. The doctors, as we know, that are all mostly being sued, again, being blamed for her choices. She definitely did ask for help, and to be honest with you, she got more help than most people do. She got over 5 appointments with a mental health, with a psychiatrist in 1 month. Do you know most people don't get more than 1 appointment in maybe 3 to 4 months with a psychiatrist? Like, the people that are saying that she didn't get enough help, it's absolutely ridiculous. She dumped Dr. Tufts when she didn't like what she said about the Ativan. She went to the hospital. Then, in order to get out of the hospital early, she used Dr. Tufts to make an appointment so that they would let her out because she wanted to leave. She jumped around as it suited her. Again, very psychopathic, narcissistic behavior. I'm going to use this person for what I need, and then I'm going to go over here and I get what I need over here. And then if shit goes bad, then I'm going to blame everybody else instead of being like, what did I do to contribute to this problem? I also have a really hard time with the wording after the murders. Waking up and feeling horrified. What was she being horrified from? Because some of the other testimony was saying that her feeling horrified was mostly about her injuries. Not a lot of talk about the children. Not a lot of talk about the horrified about, I just murdered 3 children. Which is not normal. That's not normal. And it's not, you can't blame the meds. I'm sorry. That's not normal. And even referring to this as my tragedy, in her words, I would say it's the kids' tragedy. The kids were the ones that were murdered. And that Dr. Zeisel, who, let's face it, he's like a 20-year-old friend of Red, the defense lawyer, and Dr. Zeisel, who, in my opinion, is extremely unethical, has some sort of personal relationship with her, and it gives me the weird vibes. I don't know what the heck. Very inappropriate. And it seems that he said very quickly in his testimony that he gave her the hair test, which is HARE, and it's a test to test for being a sociopath or not, or tendencies. And he said very quickly, oh no, she didn't qualify for that. Well, my question to you is, I looked at this scale for sociopathic behavior, and a lot of the things on the scale, there's absolutely no way you could properly score a person for whether they're sociopathic or not by just meeting them, because a lot of it has to do with patterns. So that's inaccurate in itself. Also, hearing the testimony of the chaplain and this Dr. Zeisel, how many times they've seen her after in the last several years, 200 times, 500 times. Again, the pattern of constant need for this outward validation and like propping up. Like there's no, it's everyone else's job to make sure she's okay, and that seemed to be the pattern way before any of the meds were involved. So that's my take it, leave it, I really don't care. That's my personal and professional speculation about this case. I think that there is a place for, it's a tragedy regardless, and I think that unfortunately I wish that if she told Patrick, if it is the case that she told Patrick and her mother that she was having homicidal thoughts, I don't understand why no one told anybody that. And my question also to the family is, why did the sister not tell anyone? Because I have a very hard time believing that the mother didn't tell the sister that information, who is a social worker. So why did no one tell anyone that? Because that would have been really, really helpful for the providers to actually know what they're dealing with. It's a crucial thing that needs to be reported. Yeah, that is a really huge tragedy that was not reported, and it's a very important case because it's polarizing, and a lot of people can relate to say, oh, well, I've had mental health, and people don't understand, mental health is really hard. But the thing is, people are projecting their own experiences onto this woman, and we don't know if that's, everyone has different experiences with doctors, with meds, with mental health. It doesn't mean that they know what Lindsay went through. It doesn't mean that they don't know that Lindsay is potentially a psychopath, that it has pretended now that this is what happened, and because of the civil suits and all the defense advice, like we don't know. We do not know. So I think that everyone has the right to have their own takes on that, and it doesn't mean that there's no compassion for the defendant, but let's have compassion for the children that were literally, from what it sounds like, viewed as obstacles to this person's stress. And it's just such a tragedy that they weren't protected more, because there were supports. Family was extremely supportive. They had a nanny, and she had multiple doctors trying to help her. So this didn't have to happen, and it's such a tragedy, and it can't be changed. But I really do hope that there is as much legal consequences as possible for this triple homicide. Thanks for listening. Don't calm down, because the world needs you.